So people ask a lot about some of the orbital procedures as well. And some of the common things that we'll do is when we're evaluating the face, we can look at the position of the eye or the globe. And if there's some asymmetry, particularly if one globe is higher than the other or one is lower, there may be a history of trauma, there may be a congenital or something that's been present since birth, or it may just be a natural appearance that's occurred. There's various things we can do to try to equalize that. Often the most frequent thing that we do is an orbital decompression, where some of the bone is weakened around the side of the eyeball that's elevated a little bit more. In those patients, they tend to show a little bit more of the white of the eyeball between the lower lid and the colored portion of the eye. So we want that eyeball to sink down and in a little bit. We also look at the support of the bone, of the maxillary bone or the infraorbital bone, and often that needs to be augmented or some structure needs to be placed there to help support the lid as well. But it's a combination of thinking where the eyeball itself should be situated within the orbit, what that lid position should be, and where and how that amount of white or scleral show should be present and evident. There's other things we do to the lower lid as well, such as some PRP, platelet-rich plasma injections, fat injections. We can laser, we can do lower lid blepharoplasties, all to help with the orbital and periorbital aesthetics. Sometimes we're tightening the canthus or the corner of the eye to change that angulation and position. Another less common area, but something that's at times we get inquiries about, is there a way that we can change the width between the eyes? Or what do we think about in the width between the eyes? And typically this is something we do more in syndromic craniofacial surgery for syndromes like Cruzon, Apert, Pfeiffer. But in times this can be a post-traumatic thing that we'll want to do, as well as something rarely for aesthetics. So with the 3D planning and tools that we have, there's ways by which we can move the picture frame around the orbit to change the position and inclination. At times this can be down in and around the face and does not need to involve the forehead. At other times we want to encase the entire orbit and move it as a picture frame, in which case we tend to do that at the hospital with a neurosurgeon as well, to really reposition both three-dimensionally the orbits in space, widening, changing the inclination, changing the yaw position of those orbits. So those are things we can do with craniofacial surgery, aesthetic surgery, and 3D tools and plans. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.